Hi everyone, this is Dr. Ramachandran, consultant spine surgeon from Aster Whitefield Hospital. I'm an orthopedic spine surgeon with exclusive spine experience of around 12 years. You will be listening about the scoliosis in this video. So first, what you have to understand is what is scoliosis, right? So when you see any person from front, the spine should be in the center, straight. But in case, if it is bent to one side, either to left or to the right, then we term the condition called as scoliosis. In generally, many of the patients might sit in different positions and that is not called as scoliosis. But inherently, even if they try to sit erect, but still they are bent, that is called as scoliosis. So it is also called as bent spine, crooked spine in general layman words. But the commonest cause for scoliosis, you know what? We don't know. That is we call as idiopathic scoliosis. There are other causes which are called as congenital scoliosis, where by the birth itself, if one of the bone is not formed, when the person starts growing, they start bending towards one side. That is called as congenital scoliosis. In certain conditions, the muscles are the one which is like giving the support to the spine, right? If one of the side muscles are weak, then they start bending. That is called as neuromuscular scoliosis. Certain conditions which might be inbuilt within the spinal cord, there might be tumors. That tumors make the muscles become weak and that can also produce scoliosis. It is also called as the same neuromuscular scoliosis. Gone are those times where polio was so rampant and people presented with having limb length discrepancies, short limbs, then they developed that scoliosis. And now, but the most common being the idiopathic scoliosis. So this video will be more emphasizing on the idiopathic scoliosis. So the idiopathic scoliosis, which is as I told, there is no reason found behind it, is commonly seen in girls. There is no specific evidence to say why it is common in females, but during the age of menarche, there is some discrepancy with respect to the growth of the legs, the spine bones and the muscle development, and they start developing a bend. And this is usually attributed by their family saying that the kid is not sitting proper and the kid is carrying weights in the form of bags. That is a cause for scoliosis, they think like. No, it is not at all. Say once your kid is not sitting properly, to all parents, you are finding that kid is not sitting properly, don't say that she is sitting in the last bench or in the corner of the bench and that's why she is bending. No, first rule it off. Ruling it off by you itself is possible. Ask the kid to bend forward and see from back the humps up and down in the back, or just strip the kid in front of you, look from back, look for the shoulders up and down. Those things with the shoulder blades being uneven, those are the easiest ways to identify scoliosis in home itself. So these tests are called as Adams forward bending test and scoliosis screening. This is good enough for you to identify that the kid is having a problem or not. So when in problem, we are readily available to help you. Most of the times this is a screening which is being commonly done in developed countries where the resources are there. But in India, we don't have that much amount of resources with medical. You can yourself screen and then identify the problem at earliest. Why I say? Because if you are leaving it for longer days and years, the kid might have multiple issues in the form of cosmetic issues. That is the last, but sometimes the lung development, heart development, the pain in the back starts increasing. So better identify earlier. Once it is identified, we do what? We do X-rays, and only if the problem is, say, we call it as measurement of the curve in the form of Cobb's degree. When the Cobb is more than 50, then it comes in the worrisome. Trust me, it will not be that much. So you don't allow it to grow to that extent and come at a later stage saying, sir, I should have identified before. In Aster Whitefield, we have a combination of neurosurgeons, we have a combination of orthopedic surgeon as a me. We can identify the problem, treat accordingly. When we say treatment, majority of the people think spine surgery, it means always surgery. No. Major problems, as I told, less than 50 degree is managed in the form of exercises, braces, yoga, swimming. That's it. This is far sufficient to control the growth of these bent spine. so that they will not end up in having problems, or we can even avoid a surgery. But if the degree becomes more and more in the form of 50 degrees, then we have to intervene to produce a good quality of life for the kid. We are always there in Aster Whitefield Hospital to help you out. Please reach us at any time.